Hi, my name is Joseph Irizarry. I'm going to go through an instructional video on how to use an AED to help save somebody's life. So when you get called in and you see someone down, whether it's in the field or whether you're a paramedic or what have you, you come in, first thing you want to do is make sure the scene is safe, because if the scene is unsafe, then if you get injured, you're not of any help to the patient at all. So we come in, make sure there's no obstructions, nothing that threatens our well-being, and as long as the scene is safe, we approach the patient. We're going to lean down next to them, we're going to tap their shoulder, we're going to yell to see if they can hear us, and they can respond to us, check their level of consciousness. Can you hear me? Are you okay? Can you hear me? So we have no response. So the next thing we're going to go to is we're going to try and see if they'll be responsive to painful stimulus. So we can pinch his fingernail beds and see if that elicits any response. Nothing there. So he's not responding to verbal or painful stimuli. So now we're going to go and look for his ABCs and check from there, and then go down the line and see if we need to activate 911. So we're going to go next to him. We're going to do a couple different things. We're going to check his pulse. We're going to check his respiration. So I'm also going to check his airway to make sure that he didn't pass out from obstruction, choking, or anything like that. So we're just going to open the mouth. We're going to look inside, see if we can see any obvious obstructions. There's none there. So now we're going to check the pulse. We check the pulse on our side. So in case you're out in public and something like this happens, you don't reach over, because then someone who doesn't know may think you're choking the person, and that can lead to legal trouble or anything like that. So we're going to check. We're going to open the mouth, and then we're going to look for rise and fall of the chest. Listen for breaths. Feel for breath. We got nothing. There's no pulse. No respiration. So now we're going to have to get an AED and activate 911. So if I'm by myself, I'm going to get people to help me. Hey, can you call 911?
All right, calling.
And while he's calling 911, hey, can we get an AED over here?
There's AED!
All right, so we have the AED. The AED is very simple to use. You just open it up, turn it on, and you have the two pads. So this is just a run through, so we're going to keep his shirt on, but in a real situation, you would take the shirt off or cut it if you had to. The pads tell you where they go. So for this pad right here, it's going to go on the left upper portion of his pec, on his right-hand side. Make sure it adheres firmly. Also, if there's any obstruction like hair, you may have to shave it. Also, if the patient's been in water, you'd have to transport them and dry them before you do this, obviously because of the electricity. So this pad here will go underneath on the left side, on the ribs right there. Make sure they adhere firmly to the skin. So now that they're there, we are going to have the AED. It will assess the heart rhythm for you, and it'll go through whether or not you need to deliver a shock, and then we'll go through and
analyzing heart rhythm.
So it's analyzing the heart rhythm now. We steer clear.
Do not touch the patient. Analyzing heart rhythm. Shock advised.
Okay.
Do not touch the patient. Press the flashing shock.
All right, so we stay clear, and we press shocks. That way, there's no danger to us.
Shock delivered.
It'll give the shock.
Begin CPR.
All right. Now we start CPR. At a ratio of 30 chest compressions to 2 rescue breaths.
20. 30. Give 2 breaths.
And then when you give rescue breaths, make sure you look to see if his chest rises to make sure that air actually gets inside. And we just keep repeating this process for a couple of minutes, 2 minutes or so, and then we reevaluate his ABCs, his vital signs.
20.
And we keep doing this until paramedics arrive.
30. Give 2 breaths. 10. 20. 30. Give 2 breaths.
At this point, it should reevaluate. You just keep doing so. And like I said, we just repeat this process until the paramedics arrive.
20. 30. Give 2 breaths.
And it looks like the paramedics are here, so we're going to keep doing this until they take over.
You good?
Yeah, you're good.
I'm checking his vital signs, okay?
Okay?
Good. Have blood pressure cuff. Good.
20,
Hey. Hey. Good.
30. Give 2 breaths. Stop CPR. Apply pads onto patient's bare skin.
And that's the process you go through. The paramedics will take over from there and we will transfer care to them. And that's the basic steps you go through when using an AED.
We gotta send them out.